Hello everyone. My name is Rob Hatton. I'm the communications manager with Grey County, and I'll be hosting the call tonight. Joining us on the call, as always, is Jennifer Cornell, our Director of Long-Term Care with Grey County, as well as Dana Leach, our clinical specialist. Our format for tonight will follow the same process as you're used to, where we'll have an update from Jen. She'll explain some of the changes that have been happening recently, and then we'll open the floor to questions and answers. We do ask that you please do use the Q&A feature to put your questions in. It just helps us track things. We will keep an eye on the chat feature as well to try to catch them there, but really the Q&A is the best way to make sure that your questions do get answered. I would also just like to say that we are recording the call tonight, and we will share a link to this recording in our follow-up email that goes out. Please feel free to share it with anyone that you do feel would be interested in the material that we're covering tonight. And one last piece of business before we get going. I would just like to remind everyone that this call is for Wednesday, November the 2nd, 2022. The video discusses matters related to residents of long-term care homes operated by the County of Grey. Please feel free to share this video with others in the Grey County community. And if you're watching this and you have a family member in a long-term care home that is not operated by Grey County, please contact that home if you have any questions or concerns about their care. So I think that takes care of all of the business, and I will pass it over to you, Jennifer.
Great. Thanks, Rob. Good evening, everyone. Nice to see lots of you joining. So I have a few updates, and I'll just jump right into it. We last met virtually on September 8th, and we continue to see all three homes supporting the de-escalation of a variety of pandemic strategies, but still balancing the risk of infection and outbreak and being really aware of what's happening in the communities around us in terms of the prevalence of lots of stuff going around with COVID and other respiratory illnesses. So historically, I've updated the number of long-term care homes that are in outbreak across the province. Unfortunately, that data is no longer easily available to us. I can share, though, that locally there are 15 long-term care homes or congregate settings that are either in a COVID outbreak or other respiratory illness. So as I mentioned, we're making our way through pandemic recovery, but still very much in influenza and respiratory illness, COVID illness season. In this update, I'll review the an update about the outbreak that is happening at Grey Gables, highlight changes in the pandemic guidance from October 14th, and that includes touching on surveillance, testing, and masking changes, updating on visiting, outings, including eating together, a little bit about vaccines. I am going to talk a little bit about communications and outbreak updates, and then a couple of non-pandemic items, Christmas planning and resident and family satisfaction surveys. So getting right into the Grey Gables outbreak update. Yesterday, an outbreak status update was shared. We have received test results that have identified 10 new positive resident cases yesterday for a total of 13 active resident cases. We are saddened to report that one resident on an outbreak home area has passed away. And on behalf of Grey County Long-Term Care, Grey Gables team and residents, we extend our heartfelt condolences to the family and friends, and our thoughts are with them. The update went on to give some specific details around 10 residents have COVID on Valley View and 3 residents living on Pine Ridge. We will continue to provide updates on Tuesdays and Fridays, as we have been for the last number of months. I would like to talk about communications going forward for outbreaks. So after this Grey Gables outbreak is declared over, we'd like to make a change in the communication process. So we'd like to align the COVID outbreak communications to be the same as how we communicate other types of outbreaks. Just to remind everybody of the methods that we have. So we have two methods that we use to send out communications. We have the MailChimp, which is an email distribution list that anyone can subscribe to through our website. And this is how we send out broad communications like our newsletters, media releases, and COVID updates and outbreaks over the past number of years. We also have Clinic Connects, which is an internal communication tool that is set up for substitute decision makers, power of attorneys, family members designated by residents when they move in. And this there's a few options. This can be an email, a text message, or a phone message. And as we transition our COVID outbreaks to be handled similarly to other outbreaks, this is what it would look like. So we would send a MailChimp, which is that broad media release type communication, as well as a Clinic Connects, and post on our website that an outbreak has been declared by public health. And this is not a change. This is what we do now, and we'll continue to do that. The Tuesday and Friday outbreak updates would move to only Clinic Connects, and we wouldn't be using that broad MailChimp method to provide COVID updates on Tuesdays and Fridays. This is how we handle other outbreaks, is we use that Clinic Connects tool to give the midweek updates as they come. And then we would use both the MailChimp broad distribution list and the Clinic Connects to announce that the outbreak has been declared over. As always, when we make a change, we'll try it out. We would be really glad to have your feedback and make adjustments as necessary. And if you have any concerns about this, pop them in the Q&A or send us an email if you have some opposition to making that move. We'd like to hear what you have to say. And so now moving into the updates, COVID guidance updates were released by the Ministry of Long-Term Care to be in effect October 14th. And a number of those, we have made that transition. We are taking a very balanced and cautious approach, trying to really promote a life and a life of joy, and still balancing the risks that come with flu season, COVID, respiratory illness, and how we can have both of those things taken care of as best that we can. So the changes are, screening requirements have shifted from active to passive screening for staff members. We are still tracking that the passive screening has taken place. We're working on a digital solution so staff can complete their screening on a digital tool ahead of arriving at work. And then we're able to track that and have that information as we're required by the Ministry of Long-Term Care. The ultimate goal continues to be reducing the risk of infectious respiratory illnesses within the home and having team members do a check-in with themselves against the symptom list before they come into work. Active screening for visitors and caregivers continues to be recommended, and we continue to have this in place in all 3 homes. I have these a bit out of order, I think. So I would just like to say that we will be continuing with daily rapid antigen testing for everyone. So all staff, students, support workers, volunteers, designated care partners, and general visitors will continue to do daily rapid antigen testing or every time they arrive at the home. And so they may do passive screening, but they will still do a rapid antigen test. And there's not been a change in the approach if you've had COVID recently. So individuals who have had confirmed COVID-19 infections resume rapid antigen testing 90 days after they've had COVID. So I'm just going to pop back up. Masks continue to be required for all long-term care staff, as well as for visitors and others entering the home. While masks are recommended, so this is directly from the ministry guidance document, while masks are recommended, they are no longer required when visitors or caregivers are alone with a resident in their room. And I am just going to share my screen of a poster because I think this is the best way to, to just go through these details. So Rob, can you just let me know that I'm sharing the right screen? And You can
Yep.
see a poster? Okay, great, thanks. So this is the indoor visit update poster, and this highlights the protocols around how to safely unmask and when you should have your mask on, and the rules around visiting. So in-room visits are limited to all general visitors who have had at least 2 COVID-19 vaccine doses. Unvaccinated general visitors may still visit at a pre-scheduled indoor visiting station. And as we discussed at the last family virtual call that we had, if you wish to visit, you're unvaccinated and you wish to visit in the room of your resident, then you need to connect with the leadership at the home, and they will support you through a risk assessment so that we can make sure that we can do that in a safe way. We make sure that we have good ventilation and HEPA filters, and you're also required to wear a best fitting N95 mask.
Jen,
Yes.
sorry, can you just zoom in a little bit?
Oh, I sure can. Thank you. Yeah, I have a big screen, and so I forget that it might not show up. Okay, is that better?
Yes, that's better.
Okay,
Thank you.
great. Thanks. There is no limit on the number of visitors unless we're in an outbreak. And I will just also add that in some booked spaces where people will be eating together, there are some limits in terms of how many people can be in that room. And so we'll talk about that a little bit later. All visitors must complete active screening and rapid antigen testing, and masks are required for visitors and others entering long-term care homes, but ministry no longer requires caregivers and visitors to wear masks when they are alone with a resident in their room. Designated visiting areas have been implemented for residents that have shared room, and I think my poster, I must have accidentally deleted some words. And we do encourage hand hygiene and physical distancing to help reduce the spread. And I'll just bring the screen back. And I will just say that when you are in your loved one's room and there's no one else there, you and your person, then you can take your mask off and have a visit unmasked. And I understand that the reason behind this, and it makes good sense. I found this too when I was visiting with my grandma, that sometimes communication was really difficult, and I just desperately wanted to pull my mask down and say the words that I was saying so that she could read my lips and help with understanding. So it does absolutely make a difference in communication. And I know that there are lots of spouses and partners who really want to see each other's faces. So if you're in the room with your person and it's just the two of you, then you can take your mask off. If a staff member or a volunteer or another resident comes into the room, then you need to put your mask back on. And if your person is in a shared room and their roommate is out, you can take your mask off. We do ask that, as you would anyway, respect the roommate space and stick to your person's side of the room, and have your visit over on your side. And if the resident comes back, then the mask needs to go back on. And there might be questions, and so we can talk a little bit more about that. Physical distance requirements have been updated to align with other high-risk settings. So physical distancing continues to be encouraged, and residents continue to be urged to avoid situations like crowded places where COVID-19 can spread more easily. Long-term care homes can return to regular practice of setting their own visitor policy. So this is just highlighting that change. The province had originally set a limit of 4 visitors, and that has been removed. Daily screening of residents for signs and symptoms of COVID-19 and screening of residents upon return from an absence continues. So we continue to watch and be paying attention to people's symptoms. Are they feeling lethargic? Do they have a bit of a runny nose? Are they complaining of a sore throat, a headache, fever? We continue to do that surveillance. But the testing of residents on day 5 is no longer required unless they have symptoms. And as I mentioned before, we will continue with our daily rapid antigen testing for all staff, students, support workers, volunteers, designated care partners, and general visitors. And we do, I looked at the stat earlier, and it's still something like 2,000 rapid tests a week across the 3 homes. And we do continue to screen people who have COVID-19 and didn't know they did. So it is still working. And so as long as we have the supplies and people are pretty good at coming in and knowing the drill and how to do it themselves, we're going to continue to do that. Regarding just again to reiterate that we're going to continue with universal masking, using surgical masks, except on home areas that are in a suspect outbreak or a confirmed outbreak, where we do switch to N95 mask use and eye protection, and we continue to provide those, and they continue to be available for all staff anytime and all designated care partners. Regarding overnight absences, there's still no change. All residents may go on an overnight absence. Just a reminder, to arrange a social outing, please contact the home and speak to the registered nurse or the resident family services manager. As we have previously, we'll talk about the plans, assist with a risk assessment, and help work out the details. A reminder that anyone who will be in the vehicle with the resident is encouraged to do a rapid test at the home prior to the outing. Masks are encouraged to be worn at all times and if tolerated by the resident as well. And we'll also remind you of the public health measures that are in place, hand washing, distancing, and so on. And it's really important to be aware of what's happening in the community. If there seems to be a lot of homes and schools and daycares having illness, then it means that there's a lot of it out there, and be thoughtful about where you're going and how you're interacting with others. And we already talked about the process for unvaccinated general visitors. So eating together. With this change of being able to be unmasked when you're alone with your resident, it opens the door for people to be able to break bread together and have a coffee. And I know that that's been a big, meaningful part of how people visit. So a visitor or a caregiver can now eat together with their loved one under the same circumstances as removing your mask. So when you meet the general visitor vaccination requirements, you have a minimum of 2 doses of COVID vaccine, and you're alone in a room with a resident, you may remove your mask and eat or drink together. If another resident or staff member or volunteer comes into the room, you put your mask back on. If you're an unvaccinated visitor, have completed the risk assessment, and you're visiting in the resident's room, you're required to wear an N95 mask at all times and keep it on for the entire visit. All 3 homes are accepting bookings for family and friends to reserve space for small gatherings and holiday functions. I encourage you to check out the newsletter for your home. It outlines the specific details for each home, and some of the number of people limits per room change depending on the size of the room and at the home. So check out those specific details for each home. As I've mentioned, community transmission and there's an increase in cases locally is concerning. And so we encourage everyone to get vaccinated and boosted as you're eligible. We continue to provide COVID vaccinations to residents, DCPs, and staff as they become eligible. Influenza vaccinations are available for residents and staff at each home. So reach out to the home for a COVID vaccination if you are eligible and you would like one, or to a local pharmacy or your physician for either COVID or the influenza vaccine. On to some of the non-pandemic updates, which is kind of exciting to be having space in our meeting to be able to talk about some non-pandemic items. The resident and family satisfaction surveys are ready to be released, so watch your emails. Those surveys are coming. Your feedback is really important to us in ensuring that we're making ongoing improvement. We take your feedback and use it to help build our strategic plans and our education and our project plans for the upcoming year or years. So please, we need to hear from you. It's really important. And staff are working on meeting with residents to complete the resident satisfaction surveys. I did talk a little bit about booking space. So each home has space available for residents and families to book their gatherings. Room capacity varies. If food or drink is included, guests must be fully vaccinated, and contact your resident family services manager for details. Each home is busy working on plans for the upcoming holiday season. Activities will include photo ops with Santa, holiday decorating activities, entertainment, Christmas markets, cookie decorating, all sorts of things. So watch for more information and updates in the newsletter and posters around the home. We have had some people asking about gift ideas or ways to acknowledge the staff at the homes. And so while it's absolutely not necessary, those gestures are really appreciated. And so some ideas are IPAC friendly, so infection prevention and control friendly items like individually wrapped candies, cookies, chocolate, munchies, snacks, that kind of thing is great. Did just want to let people know that those items go to the shared staff room so that everyone can partake and enjoy. And the cards are usually posted, and so people can read them. And it's the kind words that you share are really meaningful. So those are some ideas for that. Some gentle reminders: hand wash, hand wash, hand wash. Mask and distance from others unless you're alone in a room with your loved one. A reminder to check in advance with staff when residents are going out so that medications and other arrangements can be made. And finally, I do just want to acknowledge that the change to this opportunity to unmask may be concerning for some people. And I just want to remind us all that everyone who's in the building who is eligible to be taking their mask off has been actively screened, has had a rapid antigen test, is well versed in IPAC strategies like hand hygiene, and most importantly, they care about the people that live in the home and they care about the people that work there. So it's a good reminder for all of us that this is a balanced and thoughtful approach, and people care about the people around them. So I'm gonna leave it there. Thank you for your patience. That was a lot of an update, and looking forward to getting to some of the questions and discussion.
Excellent, as always, Jen. Thank you very much. So we do have a few questions to get us started here, so that's great. And if you have anything else, anyone listening, any questions to ask, please just put them in the Q&A and we will get to as many as we can here. First one here, just a comment and then a question. So since the ministry has relaxed the COVID-19 restrictions, it seems that COVID-19 outbreaks have increased. And then the question, is Grey County going to follow the new protocols even though COVID-19 is so prevalent? Can we institute some extra measures for everyone's safety?
Okay, great. Thanks. Thank you for that question. And these are exactly the conversations that we have. And it's great to bring the team together, and we talk about all of the worries and the options. And so we are following the guidance document from the province in terms of creating space that's designated for people to be able to remove their mask safely, creating an environment in the home where people can be with their person alone and take their mask off, and how the reminder to put it back on when someone comes in the room, and those kinds of things. We are instituting extra measures in that the requirement of daily rapid antigen testing is a Grey County policy that's above the requirement of the Ministry of Long-Term Care. And it's a commitment that I made to the residents, the staff, and all of you a number of meetings ago. As long as we have the supplies and are able to do it, I want to make rapid testing as available as possible. So it's still required. That's above the standard. And if it comes to a time where that's being de-escalated, my hope is that we will continue to have it available so that people could go there voluntarily and do their rapid test. But I don't see us changing the requirement of daily rapid testing anytime soon. So that's one area where we are above the requirement. Happy to take suggestions if there are, Kathy, if you have suggestions you'd like to make about what additional measures would look like, happy to hear them and take them into consideration.
And would email be the best way to submit those to you, Jennifer?
Sure, that would be great. That'd be great. And then I look at Dana, I think is going to add something.
Yeah,
Sure.
so I just wanted to say we also, as Jen alluded to, really had some thoughtful discussions looking at the uh, what the risks are, but we also took a look at that ethical framework that we are bound to support through the Act. So we have a framework that guides our decision making. And as well, I think we reached out to the ministry when we did reach out to the ministry and asked, hey, can you send some more HEPA filters? So in the last couple of weeks, I think we've received 16 more HEPA filters that the province was submitting. So we could put those strategically in those visiting areas, again, improving air quality throughout. In addition to, I think we were rapidly getting both flu vaccine and COVID vaccine. So I'm pleased to see we've almost completed those for the those that are eligible.
Very good. Okay. This question is from Jane. Why does someone who has had COVID-19 have to wait 90 days until they are retested?
I'm going to defer to Dana.
Yeah. So when we're talking about the 90 days to wait, that is to get the surveillance testing of rapid antigen tests. So the RAT test, you might hear everybody talk about the RAT test. So because it can continue to detect the antigen, and that's what that test is looking for, the buildup of antigen. So it can continue to detect that. Now that doesn't mean if somebody in the interim is ill and has been connected with somebody who's a high risk for COVID, that's when the indication for doing an additional test. We wouldn't do the RAT test in that case. We would do a PCR or a molecular test because that's going to actually detect the virus, not the antigen. So that is best practice. And some people they identified could still be shedding and could be, we could be identifying the antigen, and we don't know if this is an old infection or a new, whereas the PCR can detect whether it's a new infection. Again, it would be clinically warranted to do a PCR. That's the nasal pharyngeal one as opposed to our RAT test. I hope that helps. So it's not that we aren't testing, we just are not using the rapid antigen testing within that 90-day frame.
Thank you. That was a really good explanation. I have wondered about that actually myself, so great question. Do we still need to wear the mask with our resident if we take them outside, but still at the home, so still on the property?
So I think this is where you do your own mini risk assessment and have a look around. So if it's just the two of you and you're outside and you are super confident that you're healthy and your person isn't at risk and you're not surrounded by a bunch of people and you're outside, it's fine to take your mask off. If you become in a group of people, then it's best practice to put your mask back on. Does that jive with what you're thinking, Dana? Yeah, okay.
Great. When visiting with your loved one in their room unmasked, are we able to eat with them as well?
Yes.
Hooray.
Hooray. I know it's been a long time.
Yes.
I know this has been a long time that people wanted to share a cup of coffee and in the summer share an ice cream. It's really meaningful connection. And so, yes, you can.
Always encouraging hand hygiene before and after, though.
Oh, right.
Yeah.
Wash your hands, wash your hands, wash your hands. Yeah.
Great. And then these next two are both asking if I visit my father daily with my mother, he is in a private room. So can we take our masks off when alone in his room as a group of 3?
Yes, you can.
Perfect.
And so again, do that, if somebody was maybe they had a cold, they weren't feeling great, but it wasn't COVID, has it been a few days? Was it yesterday? Just kind of just the same way you would in any other illness. You heard someone had the stomach flu, you might back up 2 steps and continue your conversation. So just that same really thoughtful approach, but yes, you can. And I encourage you to check out the newsletter when it talks about eating together as a group at a family gathering. There's some good suggestions and recommendations. So if there's a group of you gathered together at Lee Manor in the family dining room, there might be 7 of you for a holiday gathering. We recommend you leave your mask on while you're visiting and getting together. Take your mask off to eat. When you're done eating, put your mask back on, because you still are bringing, multiple families together, potentially groups of people from different households, and it just helps minimize the risk. And I'm reluctant to talk about Christmas and not be setting us up. So our goal is to have our homes open and available to everyone over the Christmas holidays. I can't make any promises, of course, but we're all doing our best to keep the homes outbreak free, and we rely on everybody to be a part of that goal.
And Jen, if I may, if by chance, you have had a really nice visit, had a meal together, you had your mask off, and let's say, because these rapid antigen tests are about looking for the antigen, and you may have been brewing COVID previously, if by chance you do get ill, call us after your visit so we can keep a good eye on a person to make sure, and that's what we want to do: early detection, early support. And so please don't hesitate, don't feel bad. I mean, we are in a particular situation here, so just reach out, and we're not about finger pointing, we're about being supportive. And so if it happens, and many of us have been there, our family members, give a call. Don't pause, don't hesitate, let us know, and then we can follow up.
Yeah, thanks, Dana, for mentioning that, because it really is our best way to minimize the spread is to know about it early, put our measures in place, and that keeps as many people as possible at lower risk from getting the illness. So yeah, give us a call. And I do just want to also remind everyone, there'll be posters up around the home reminding when can you take your mask off, when can you not. So we're trying to make it the environment as easy as possible to know the rules, because there's been a lot of rules over the last 3 years. And then I just will highlight that if you are unvaccinated and you're visiting, we are asking you still to leave your mask on, your N95 mask on, for your entire visit.
Okay, thank you. Question here: will it be possible in the future for a designated care partner or visitor to pay for the same meal as the one that's provided for the resident at the long-term care home?
Thanks for that question. We have had that set up historically in the past, and so I'll take that feedback back and get back to everyone.
Okay, thank you. That is all I'm seeing for questions right now in our Q&A. So if there aren't any more, maybe we will just go to end it there. As always, if something comes to you after the call that you would like answered, please just send an email to communications@grey.ca or reply to one of those newsletters that we send, and that will come to us, and we'll make sure that we do get an answer for you to those questions. And Dana or Jen, do you have anything else to add before we end the call tonight?
You would be disappointed if I didn't have something to add.
We would.
So thank you. Thanks so much, everyone. I do want to thank everyone again for your commitment and engagement. And I want to highlight that Grey County Long-Term Care, which is all of us, and families, residents, staff, continue to be a leader and driving force in person-centered care. And so I'm delighted to share that We have been part of a special project with the Ontario Centres for Learning, Research and Innovation in Long-Term Care that includes a video called The Magic of Connection, Essential Care Partners in Care. And so this is a video that features many beautiful scenes from Grey Gables and many of our residents, our team members, and most importantly, our designated care partners. That it's about you. And so we'll share the link in the video in the follow-up email, and I hope that you'll take a few minutes to watch it. And I know that you'll feel the same pride that I do. And I wish you all a wonderful evening, and thank you so much for joining us tonight.
Thank you. Good night, everyone.